I'm not going to even attempt to pronounce the next cancer that we're going to discuss with my guest, Cindy Lovelace, because it is a mouthful. Neuroendocrine?
You are very good at that.
Okay.
Yes.
That's close.
But that is why we call it NET for short.
NET cancer.
NET cancer,
All
yes.
right. And Cindy, you started the Healing NET Foundation out because of your personal journey, and I know we could talk the entire segment about that, but tell me a little bit about your journey to get to this place, to start this organization.
Sure. Well, I was already a breast cancer survivor at the time that I was diagnosed with neuroendocrine, and my tumor was found incidentally. It was kind of a providential situation. I had developed blood clots because of a reaction to a drug that I was taking with my breast cancer therapy. And as a result of that, the blood clots, I went to the ER, and when I was diagnosed and they did a scan of my lungs, the technician just happened to note down in the lower corner of my scan that they saw a shadow. I followed up with my oncologist, and several months later, they actually diagnosed a neuroendocrine tumor. And they did this through an endoscopic ultrasound. And it was found in the tip of my pancreas. It was pretty amazing that they even found the tumor.
You had no symptoms.
I had no symptoms whatsoever. And as a result of that, I assumed there would be a protocol for neuroendocrine cancer. And what I found out from my oncologist is not only was there not a standard protocol, but she actually didn't know very much about the cancer because it was considered so rare. And I had it resected, had a really great surgeon, and I was doing well. And then in late 2011, I was watching CNN News with my husband, and the story came on that Steve Jobs had passed away. And Dr. Gupta with CNN went through this whole process of explaining that Steve Jobs had neuroendocrine cancer.
And you were floored.
I was floored. I was shocked. I Googled it again, not like I didn't before, but this time the first person to come up in my search was a doctor at Vanderbilt, Dr. Eric Liu. And he had started a neuroendocrine center. And I couldn't believe it. And I said, what? There's a doctor right here in Nashville, Tennessee that knows about neuroendocrine. Turns out he and my oncologist were good friends, but she didn't understand what he was doing, that he was a surgeon that did neuroendocrine. And so that was the odd, 6 degrees of separation there of not, having that connection to know that there was an expert in the disease. And so when I went to see Dr. Liu, he was able to explain to me so much about the disease, and had also trained in Sweden and had started a clinical trial at Vanderbilt for the first gallium-68 scan in the United States.
And that's how they're tracking them?
Well, this is a new diagnostic tool. It was this was in 2011. It's now been approved by the FDA in 2016, and it tends to light up these tumors that other scans miss. In my case, I had had an MRI on my liver, which showed that it was clear. But when I took the gallium-68 scan, 2 tumors lit up on my liver. And so I never would have realized this had it not been for that diagnostic treatment.
So what was the next step then? What was your treatment after those tumors lit up? What did they do?
I did have one resected. The others are watched. One of the things that we've learned about neuroendocrine cancer is that, it tends to be a lifelong management of this disease. You can resect, but the tumors have a tendency to pop up in other places, or more tend to grow in the area. And so now I'm in a watch and wait. I do take a medication once a month that will help slow the growth down even more. They're slow-growing tumors, which is a good thing, but also because they're slow-growing and can be so tiny to start, they're hard to detect.
And people are often misdiagnosed, you said.
They are, and the misdiagnosis comes in more with people who are symptomatic. Now, I had no symptoms of the disease, but people who are symptomatic have really life-altering symptoms. They have chronic diarrhea. They may have flushing, where they feel really hot and their face turns red. They may have a pain, an unexplained pain. They may have some wheezing that could be attributed to asthma. So a lot of people are misdiagnosed with Crohn's disease or IBS or IBD, and the average time for correct diagnosis, unfortunately, is about 5 to 6 years.
Oh my goodness.
Because people are trying other medications to try to solve those symptoms.
With all these digestive related, almost bowel related, intestinal Is that where a lot of the tumors live?
Yes. So this is a cancer of your hormone-producing cells. And the majority of your hormone-producing cells tend to be in what is called your gut region, your digestive area. And so typically the pancreas, the stomach, your small and large intestines, your mesentery, and then can also metastasize to the liver, as in my case. But then there's also patients who have these in their lungs. And that's where you get into the wheezing symptoms and difficulty in breathing, that sort of thing.
Do many of them start in the lungs or metastasize to the lungs?
Some primaries can be in the lung, yes.
Primaries can be.
Absolutely.
About how many new cases are there? Since it is still considered rare, how many cases do you see a year?
Well, there is some concern that they may not be all that rare because the incidence is rising. The latest study shows that about 7 in 100,000 cases, about 171,000 people in the United States diagnosed with the disease. But what we're concerned about, particularly at the Healing Net Foundation, is because so many physicians are not aware of, don't think about neuroendocrine tumors when they have a patient who is showing all these different symptoms, or even when a tumor is found incidentally. So they may not be aware. So there's a lot of people that we feel fall through the cracks and don't get properly diagnosed.
Well, we're so glad that you are here to share this with us, that you're doing so well, and glad there's the Healing Net Foundation. Thank you so much.
Thank you.
We really appreciate it.
Thank you.
And thank you so much for watching Community Health Matters.